The journey to ridding a continent of wild polio, one of the most devastating diseases of all time, is one of courage, resolve, and collaboration.
August 25th, 2020 marks a huge day in the history of the fight against polio. After 4 years without a case of wild polio, the WHO African region has finally been declared free of wild poliovirus.
Only a generation ago, in the early 90s, wild polio was paralyzing 75,000 children every year in Africa.
I was hospitalized for 2 full years. I was just sleeping in bed without even being able to turn your head, nothing. All I could do was just to talk, but I couldn't even move any part, even my fingers. I couldn't feel anything.
In 1988, the World Health Assembly endorsed a resolution to eradicate polio worldwide, launching the Global Polio Eradication Initiative.
In 1996, the African heads of state came together in Cameroon to declare their commitment to eradicate polio from Africa.
Also this year, the great Nelson Mandela, with Rotary International, launched the Kick Polio Out of Africa campaign, uniting Africans together behind a common goal: to vaccinate every child against polio.
Across the region, we saw an increase in investment, leaders rallying together, and communities mobilized all across Africa for polio eradication. We started to see a decline in the number of polio cases. It is then that we realized that it was possible to eradicate polio from Africa.
In many parts of Africa, there are areas of conflict, and anywhere there's conflict, then there's always that challenge to accessing children. You have areas that are hard to reach. There are geographical areas that have water, mountainous areas, desert areas.
Il fallait utiliser plusieurs moyens. Je peux citer bien sûr les véhicules, les motos, mais plus compliqué encore, on a utilisé des pirogues motorisées, même des pirogues non motorisées pour transporter les vaccins, pour que ces vaccins arrivent là où les enfants se trouvent.
Reaching every last African child with the polio vaccine has required countless acts of extraordinary bravery.
There was an attack or bomb blast, and 1 hour after, the teams continued their work. Whatever achievement we have made, I give it to these frontline health workers. They are the heroes that have made polio eradication to be possible.
This is a story of innovation and communities coming together towards one unified goal.
Fundamentalmente foi a implementação de campanhas de vacinação de base comunitária e também melhorar a vigilância epidemiológica, assim nós podemos ter uma resposta oportuna.
The drive for eradication has been a truly collective effort.
This is thanks to the governments, donors, non-governmental organizations, communities, and their leaders who have been with us every step of this journey.
Today, Africa's health systems and public health programs are much stronger because of the vast investments made to eradicate polio.
The Polio Eradication Program has a huge footprint of expertise and infrastructure. As we speak, the polio infrastructure is being used to respond to the COVID-19 response.
We must continue to protect Africa's children against all forms of polio and other childhood diseases, ensuring they are protected by immunization. And we must take the lessons learned and best practices from eradicating wild poliovirus to achieve Africa's other public health goals and improve healthcare for all Africans.